Now, Todd is a tough act to follow, but I'm going to do my best here. So, how many people here are from a hospital? Okay, so I'm going to be representing all 6,000 hospitals in the United States at this conference. What I want to do is just talk a little bit about, first of all, I work at the University of Maryland Medical Center and part of the system, and I want to talk a bit about the social media perspective from the hospital view, and take a look at what hospitals are doing, not doing. A little bit about me. Yeah, this is me from 1978, learning core management skills for the web. That has served me very well. I went from that into microfilm. How many people remember microfilm? Okay, that was the great information technology solution. That was going to be the tool for storing all of our data and making it easily retrievable. And I think one of the things I've learned is as you watch these technologies, you go through the same process over and over again of adopting it, using it, and then discarding it. In '94, I started doing work on the web, helped companies get their first website. Was in Baltimore at that time. And then in '99, took the position at the University of Maryland Medical Center, where I helped them build their web department and took things from there. About a year ago, I was sitting with my wife one evening before bed. She was reading a book, and I was on my iPad, and she was reading a historic novel. And she turned to me and she said, honey, can you get me a high-resolution picture of La Primavera by Botticelli? And so I was on my iPad, and of course, as you know, it took about 10 seconds to pull up this high-resolution image, hand it to her, and she's looking at it, and she says, yeah, they were talking about this picture in the book, and now I understand the detail they're looking at, and so forth. And later we were talking about that, and what an amazing thing happened. It was very commonplace, it was very normal, but we had instant access to this kind of information. Picture someone, a marketing person, a business person from 20 years ago explaining what just transpired, explaining the web, Wi-Fi, tablets, all the things that we take for granted right now. And the questions they would have, well, how much did you pay to see this picture? I mean, how did they make money on this? Why would they bother to put this information out there? All these things that we take for granted right now that would have been huge business and stumbling blocks to what we're doing. A lot of the same thing is going on right now with social media. I spend a lot of time working with hospitals, working with executives, explaining what social media is. It can be kind of strange to go from these two worlds where I'm inside a very, very conservative, very slow to change institution like hospitals to events like this with a room full of people who use technology, are very comfortable with it, and are forward-looking. But these are the kind of points that I try to explain to them, that you can't control this. It's very disorganized. You got to actually talk with people. You just can't lecture and push stuff to them. And we have to do this because this is where our patients and employees are spending their time. A lot of time is spent explaining that there's really nothing new or scary about this. This is what people have been doing with social media, is what people have been doing all since people were together in groups, talking, arguing, sharing, collaborating with their friends, family, and community. I don't know how many people have seen this chart. This is actually a couple years old, but this is when Facebook took over the #1 position on the web from Google. And for people that spend their time in the web, this was a real milestone, because Google had for so many years been the most visited website on the internet, and here this upstart comes along and in a very short period of time takes over. When I talk to hospitals, I explain that this is like Hopkins dropping to #2 on the U.S. News list. This is how earth-shaking this was. We're seeing a big change in how, in the demographics of how people are, of the people that are using social media. This is from, I believe, Pew Research, and what you're seeing here from 2008 skewed very much to a younger demographic. Now in 2010, going back to much closer representing the demographics of the United States. The Pew Internet research findings have a lot of information that are relevant to hospitals. These folks, these demographics are using social media and the web to connect and research healthcare. We're seeing this last one, 56% are female. That matches very closely to the patient profiles and of the people that come to hospitals and make decisions. 1 in 4 internet users have watched an online video about health. I know that from the videos that we have up at my hospital's website, where we have over 500 videos, a huge number of people looking at this content. They're using all these different tools of tracking weight, diet, exercise, and of course they're consulting for looking up drug information and medical treatments. This is all old news to folks in this room, but this is something that when I speak with hospitals, they're still just starting to wake up to. The big difference here, of course, is a fundamental difference between how hospitals see the world and how social media and the web see the world. Risk-averse versus risk-taking. Reputation versus authoritative sources. Very regulated, very security-minded, very tightly controlled in your data. And so these very, very different ways of looking at how to accomplish things are one of the other struggles that we have in getting hospitals to adopt social media. Some of the other fundamental changes that you know about, no-cost barriers to entry. You can discover things at your own pace. A real fundamental change in how people are connecting and getting questions answered. And it's something that is pretty difficult for a lot of healthcare professionals to accept. I thought this story was very interesting. I don't know how many people saw this from a few weeks ago. A woman talked about how she was chronicling a very serious medical incident that her son was having and not really getting anywhere and figuring out what was going on. And a friend of a friend through Facebook, who was a doctor, correctly diagnosed that her child had a very rare and very serious condition. She went back to the doctor, said, could it be this? And they said, yeah, actually it could be. They tested for it, and the child is okay now. To me, the thing that's interesting is that this was even newsworthy, because we know this stuff is going on all the time, but that's still a very difficult thing for many in healthcare to accept. I actually was talking to a group of nurses and showed this slide, and they said, you know, well, we had a case in our hospital where somebody came in and they had Googled their symptoms and told the doctor, you know, from my research, I think I have, you know, condition A. And the doctor said, okay, well, let's go ahead and treat condition A. And then they later found out that no, they didn't have condition A, they had something else. And so the nurse said, well, doesn't that mean Google is bad? And I said, well, no, it means that the doctor should have gone ahead and done the right diagnosis. So we're seeing a lot of that kind of disconnect from what people are doing to this type of thing. Some of the other issues that we're facing is really kind of understanding where are the boundary lines for professional and private presences. How many people have heard of what's been known as the placenta incident? Okay. This is something that really, I think, encapsulated the disconnect that many in healthcare have with social media. There were some nursing students at a university, and they were in a lab, and this was the first time they were going to see a human placenta and do a lab project on it. And they were all very excited about it, and they took pictures of themselves. And they asked the instructor, is it okay if we put this up on Facebook? The instructor really didn't know what Facebook was, but said, sure, no problem. They did that. 2 hours later, the instructor said, you know, I think it's probably not a good idea to put that up. So the students took it down. And then when the head of the university found out about it, they expelled all the students. I think there were like four nursing students involved in this. They went to court. The judge ruled in their favor, and they were reinstated. But this was, you know, one of those cases where there was such a huge disconnect from what the people in this room would think is reasonable and acceptable use of social media versus what the established organizations are sorting out now. I don't know how many of you know that I manage a list on my blog where I track hospitals and what social media sites they're using. This is from a few months ago, but you can see the breakdown of what tools they're using. YouTube, Facebook, Twitter, LinkedIn, and Foursquare. Blogs are a very, very small percentage of that. What you see when you go to these hospital social media sites is pretty much they're using it as a push tool. There are some examples I'm going to show you in a minute where they are being effective, but pretty much it's a push tool where they're pushing out information. Most of them do respond if somebody asks a question, but most of the time they're still just getting started on figuring out how to use these things. This tracks the growth of Twitter and YouTube over the years. This is the number of hospital social media accounts by month for each of those two. This is one I track because these two accounts, these two social media types, you can actually see the date that the account was created. And you can see that YouTube had a very slow, very steady growth. Twitter, of course, took off around in January of 2009 when it was becoming very popular in the media. So here are the basic ways that hospitals are using social media. Customer service, education, public relations, some good examples of crisis communication, and brand monitoring is also very important. One example that came up a few months ago, a gentleman named Matthew Browning sent out a tweet. His grandmother was very sick, had a very serious heart issue, and sent messages out to all the hospitals in his area asking if there was anyone that could take his mother from this small community hospital. Emory Healthcare was on the job and monitoring what was going on and responded very quickly and got her on a helicopter and to the hospital in enough time to start taking care of her. This wouldn't have happened if they hadn't been monitoring, hadn't been doing the right thing. So it's a good example of a hospital that does get it. Innova Health has pulled together blogging, YouTube, Facebook into a campaign called Fit for 50, which is a way of getting people my age to exercise and get more involved. They were able to sign up over 6,000 participants and got that many new people who had never had any relationship with their hospital before. So marketing is starting to see this as an advantage, and I expect you'll see some more of these in the future. Children's Hospital in Boston is probably the most, one of the most successful at using social media. They have 4 full-time people who take care of their blog and Facebook and all their social media activities. They have over 600,000 followers on Facebook. But when I talked to Matt Sear, who manages that, he said one of the most unexpected things of this enormous activity was the beneficial impact it had for their nursing staff. That when they were having a hard day, when they were depressed, they went to the hospital's Facebook page and they saw all the very positive feedback that was there. Which is another thing that hospitals, I think, are always worried about. What about all the negative things that people are going to say? And if you look at the Facebook pages of these major hospitals, you'll find that they are overwhelmingly positive, that people want to share these positive experiences. At my hospital, the University of Maryland, we have started doing some some patient support groups. I don't think there's very many hospitals doing this at this point, and I would love to learn about them if they are. We have 4 different support groups. This one here is for the post-liver transplant. This was something that came from our traditional support, in real life, face-to-face support groups. Those patients said, this is really great, this is helping us, we really want to continue the conversation on Facebook. It took about a year to pull all of this together. Had to get legal to approve it, had to write up guidelines and codes of conduct, etc. But we created it. We have over 30 very active participants. They are doing all the things that you would expect in a support group. They're helping each other, they're organizing events, luncheons and things of that nature, and it's very active. There's probably 3 or 4 conversations going on every day. And the last thing I want to show you was something that was an awful lot of fun, and I think a good example of how hospitals are starting to become much more agile about using social media and putting all of this together. We have a fundraising event at our hospital. It's a half marathon that raises funds for Greenbaum Cancer Center. And this year it went through a suburban area, and as the racers were running, there was about 2,000 people participating in a race. This dog got very excited and decided to join the race. Okay. Now this video, I think, tells the whole story, if it works. Mine might not work, okay. Okay, well, let me just tell the story. I'll go to the next slide. Okay. So this dog runs the race, and what we have was 2 things that made it a perfect story. First of all, we got this great video of the dog approaching the finish line and crossing it. There was somebody videotaping the whole thing. And then, of course, the owner of the dog, when they figured out what had happened, the dog shows up at the back of their house the next day, decided that this was a really cool thing and wanted to support our cancer center and was very cooperative in everything that we pulled together. So we ended up making 2 videos. One was just the first 20-second video, and we put that up, and the media picked it up, and it started to take off. Okay. We, of course, put this up on our blog, put it on Twitter, but then we created a fundraising page on the race page. So there was so we don't have Wi-Fi right now?
I don't think it's actually working.
Okay. I just wanted to go to the fundraising page if we did. So each of the 2,000 runners had a fundraising page. So after this happened, we decided, well, let's make a fundraising page for the dog. Word got out, and he raised about $25,000 from over 400 people. He blew away by like five or six times the human that was in second place. And in fact, the director of our cancer center said, when he became the #1 fundraiser, he would make him the honorary director of the bone marrow transplant unit. So there was a lot of good humor around this. Is it coming up?
Slowly.
Okay. Why don't we go back to the presentation? And none of this would have happened, and this is the message that I provide to the hospitals I talk to. Then we put up a Facebook page for the dog within 2 or 3 days of the race. The Facebook page now has more fans than my hospital's webpage. He has over 16,000 fans. We put up a little update, and within 30 minutes, it's been commented on 50 times. It's been liked, 300 or 400 times. And between the 2 videos, it's actually been watched close to 500,000 times now. So it's an example of the kind of story that comes along. It's the viral video stuff that you can't create, that you have to just recognize and be ready to take advantage of when they happen. So now, of course, Dozer is going to be our honorary chairman of the next race. So that's what I have today. I hope this has given you a little bit of an insight to what hospitals are doing, and I'm open for any questions.
Still working on it.
Okay.
Check.
Hey, Ed.
Yes.
There's a million reasons why hospitals are kind of AWOL here. So Some are doing a really good job, right? Like, it's almost like a power distribution. You got like a few that are really good. It's like a power distribution. You got a few, you know, and then it all comes down.
Right.
What seems to be the low-hanging fruit for hospitals to kind of get them in, since they're not all going to be able to do everything all at once?
Well, I think the large majority of the hospitals have done the low-hanging fruit already. They've got a Facebook account, they've got a Twitter account, they're on YouTube, and they're treating it as another push channel. So I think the biggest opportunity is for folks that are working in that hospital who are tuned in to the possibilities, like the people here in this room, to be constantly pulling out the examples of things that work inside social media that would benefit the hospital and sharing it with the folks above them. I've already seen in the last 2 or 3 years a huge shift in the perception of social media. When I'd first talk to executives and ask how many people in the room were on Facebook or even heard of Facebook, out of 20 people, maybe one hand would raise. Now when I talk to that same group, 3/4 of them have their own Facebook page. So it's no longer scary or frightening, and they're starting to see that this is something that could be a real advantage to them.
Any other questions from the audience? No? Oh, hold on.
So the story about the guy who tweeted that his mom needed an airlift, I try not to get too cynical about stories like those, because those seem like one-off anecdotes. When I think about the entire healthcare system, I mean, there had to be other channels for this guy to find a place for his grandmother. And is this really emblematic of a move to this replacing the telephone?
No, of course not.
Okay.
You know, I remember when, like 2 or 3 years ago, when there was a lot of excitement about social media and healthcare, and I remember someone who I greatly respect and admire, and I'm not going to mention the person's name, seriously talking about using Twitter to replace 9/11. You know, when you have a car, and there's this whole scenario of, well, I'm in a car accident and I need to let people know, well, maybe I could use Twitter to let them know. And I said, no, we have 9/11. You call 9/11, and there's a tool that's perfect for your need there. So there's a lot of that kind of irrational exuberance going on. But I think the question, the answer is, it's not either or. Twitter's not going to replace all the different processes that hospitals have in place to get somebody in emergency treatment for cardiac care, but it certainly is another avenue. And I think that the goal here is to at least get hospitals to the point where they understand that this is another avenue, they should be monitoring it. Now, Emory wasn't monitoring Twitter just to see if they could get a patient. They're monitoring Twitter because people are talking about them. And they might have a problem, they might have praise, they might have a complaint. And so part of being in this community is to be there and respond to these issues as they come along. That's just one example, but you're right, it's not going to replace picking up the phone.
All right, we've got a question in the back. Hold on, Fran.
It's fun to see you run. So one of the things that I think is interesting is that hospitals are also looking to transform themselves a little bit to be community care, not just places to come for emergencies, but places to come for education and well-being and so forth, and build a relationship with people before they're in crisis. And I'm just wondering if you could talk a little bit about what you're seeing there.
Well, unfortunately, I'm not seeing an awful lot, but I think that backing up on what our first speaker talked about as the basic models of reimbursement change, hospitals are going to have to be much more proactive in connecting with their community, getting the right information out there to them, and being available to respond as health issues come up. And there's a lot of ways that's going to happen, but obviously social media is going to be part of that. And I think hospitals, that's a couple years down the road. And from the data that I've pulled together, we see that a very large segment, a percentage of hospitals are using social media. So I've got some confidence that when that time comes, it won't be scary, and they'll be able to get into it.
All right.
All right.
Thank you very much, Ed.
Thank you.